All right, we're going to try this again. I'm just going to cut my... Okay, it's working now. I'm just going to get rid of the feed that we had of me talking next to the camera, and we're just going to do the presentation with my voice going in the background. So that'll take care of the audio issue. You just won't be able to see me. Sorry. Okay. Now we're back. And it is, looks like it should be working. Okay. Yep, so we'll start that over from the top. So this presentation is going to be entitled Gluten Testing Your Food. We're going to cover what gluten is, how you test for it, and why that matters. So just to start off, I've got a science background, and in every scientific publication, one of the first things that must be done is a disclaimer. So I just want to put this out there so it's clear to everybody. I am the scientific director at ELISA Technologies. We are a manufacturer of meat speciation kits for the USDA that started back in around 1991. And we're also developed and still manufacture the Easy Gluten Test Kit, which is what a lot of you are curious about here. And in addition to that, we operate an ISO accredited testing laboratory for meat speciation, allergens, and gluten. So with that out of the way, a little bit about me so you have an idea of where I'm coming from with the information I'm presenting and things that you can ask me later. Hopefully I'll be able to answer all of your questions throughout the presentation and at the end. So I started off working in engineering. From there, I went into biomedical science, where I got my PhD studying gene regulation, inflammation, and oxidative stress. Following several years in that area, I moved into food science, which is where I am now, working in meat speciation and allergen and gluten testing here at ELISA Technologies. Other focuses that I have are education. I sit on a few advisory boards for biotechnology education, both locally and for a national and international accrediting body. I have a dive and ham radio license, which unfortunately I haven't used for several years. And I'm also active as a leader in my child's scouting pack, and which obviously leads into my family. So, as I mentioned before, which may have been during the part you couldn't hear me, is I wanted to quickly go over what is going to be included in this presentation, because I know some people will be watching a recording afterward and may not want to go through everything that's being discussed. And so just to give you a quick outline, I'm going to talk briefly about what gluten is. I know many people are here because they know what it is, but I want to make sure that we all have the same starting point for any discussion, and also for questions that we may have later. I'm also going to talk about what gluten-free really means. This is something a lot of people, especially early on, investigating gluten-free products and removing gluten from their diets, take some time figuring out. So that's part of establishing that baseline of knowledge for everybody here. And then I'm going to get into a little bit about why you may want to avoid it, how you would test for it in the process of avoiding or eliminating gluten. We're going to go over what is in a test, how these tests are designed, how they're developed, how they function. And then I'm going to go over a little bit about what the differences are between the home tests that are available on the market. And at the end, we'll have some Q&A. I have Nick Lafferman here with me helping out. He will be able to respond to some questions, perhaps in the text, but a lot of those we're going to be answering as part of the live presentation, so that everybody both here now and watching this later can get all of that information. So to get started about what gluten is, getting back to the basics of this. So gluten is only found in certain cereal grains. Those grains are wheat, barley, and rye. It can also be found in some hybrid species, which are all referred to as the triticales. It is not naturally found in corn, oats, or rice. There is a compound in corn that some people refer to as corn gluten, but it is not a true gluten. Oats are naturally gluten-free. We can talk a little bit more about oats later on in the presentation. And rice, although there is a type of sticky rice, also called glutinous rice, gluten is not present in it. The name is simply due to it having the similar sticky properties. Some of you may also be aware of some of the things that are commonly contaminated with gluten, oats being a big one just based on the way that it is grown and harvested. There is also a lot of identification of gluten present in a lot of spices. And so gluten is broadly referred to as the insoluble fraction of these flours. So when you take wheat flour and you thoroughly rinse it, you rinse away a lot of the carbohydrates and other components that are in there, and what is left behind is the gluten. And you can even find this as purified gluten. It's also sometimes sold as seitan, which is sometimes used as a protein source if you're on a meat-free diet. So going into more detail about what gluten is, this is found in the endosperm of wheat. There's a diagram here of a wheat kernel. You may be familiar with some of these other components, even if you're not familiar with the structure of a seed of wheat. It is a very complex protein. So even with the time that I've worked in biomedical science, I can't think offhand of a protein that is more complex, potentially more complex than gluten. It is composed of two entire separate classes of proteins, the prolamins and the glutenins, and then some of those have different names depending on what grain they are found in. Gluten is also a trigger for celiac disease. This is primarily through a segment of the alpha-gliadin protein, but some of the high molecular weight glutenins can also be a trigger for this autoimmune disorder. In addition to that, there are also digestive issues which lead into other systematic problems throughout the body, which are broadly referred to as non-celiac gluten sensitivity. So in discussing those illnesses, that covers some of why it is important to know what gluten is and how to identify it. So I mentioned celiac disease. This is not an allergic reaction. You can turn the ringer off on the phone. It is an autoimmune disease. So it is identified by a different immunoglobulin response. It also means that the body is then attacking itself. So it is antibodies to transglutaminase are generated, and that is where the I was turning off the phone. That is where that reaction comes from. The numbers aren't clear on it, but it seems to be present in about 1 to 3% of the population. And as I mentioned before in the previous slide, it is triggered by different parts of the gluten protein. There are also the gluten-associated intolerances that I mentioned, which are, they start off with issues in the digestive tract. They can also lead to other systemic issues, ranging from fatigue and joint pain and a litany of other problems. These are caused by gluten and sometimes also caused by other proteins, or not proteins, but carbohydrates that are often found associated with gluten. So a gluten-free diet will often eliminate or reduce the presence of these other things, still having the same effect of eliminating the symptoms that a person may be feeling. And it also matters just because of food preferences. Regardless of somebody's condition, there are still consumer demands that should be respected and met. So whether you are a consumer at home or you are somebody in a restaurant that has customers who are requesting a gluten-free diet, they're your customers, and you are probably going to want to meet their requests. So I mentioned we're going to talk about what gluten-free really is. Then I'm going to focus mostly on what it is in the US. There are variations by other countries, but in the United States, the FDA has defined gluten-free as a packaged product having less than 20 parts per million of gluten. Parts per million is also measured as milligrams per kilograms. And just to put that into perspective, that works out to about 1.5 teaspoons or 6.5 milliliters of water in an overflowing bathtub. I say overflowing because a bathtub can hold up to about 300 to 390 liters 50 to 100 gallons. And so about 1.5 teaspoons of gluten is the amount that is used to define that regulatory limit in the US. And again, that varies by country. Australia is generally the most strict. And you also see gluten-free certifications. These are sometimes there's a gluten-free certification organization, GIFCO. They have a logo that you often see on gluten-free certified foods. And that is typically based on a requirement of less than 10 parts per million. So how do you keep something gluten-free? There are a lot of ways to do this. Some of you may be familiar with it. Some of you may be here because you are curious about what some of those things are. So one thing you have to have, which helps a lot, would be a clean kitchen. There are some people some members of their household may be gluten-free, others may not. In a restaurant, you may have a gluten-free or a gluten-safe part of your menu, in which case your entire kitchen may not be clean, but you do still need to maintain a clean workspace. Maintaining a clean workspace is critical for reducing cross-contact. And this extends even beyond kitchens into manufacturing plants and facilities. You have to make sure that a portion of a facility that may contain gluten is not contaminating another portion where you're producing a gluten-free product. And even when it comes to packaging, sometimes there's a starch lining in a product to help reduce moisture content or stickiness of something. And have seen that cause problems in products that are being labeled as gluten-free, and at some point in the manufacturing or packaging process, unbeknownst to the manufacturer, one of the products that they were adding, either as a coating on the packaging or in the finishing step, contained gluten, and they had to revise their entire process. And that is why it is important to know what comes into your space. Simply because you have a gluten-free space does not mean it will stay gluten-free unless you are diligent about maintaining it as a gluten-free environment or a gluten-free workspace. And in order to do that, sometimes you have to test your surfaces and your ingredients. And when it comes to prevention, if you were presented with a plate of cookies and you said, oh, well, I'm gluten-free, are any of these cookies gluten-free? And someone said, oh, those cookies there with the green dot, those are gluten-free cookies. Okay, they were gluten-free maybe when they pulled them out of the packaging, but the moment they went onto that plate, those are no longer gluten-free. So being gluten-free on a food is more than just what is on the product label. Simply because something was gluten-free does not mean that it is now gluten-free. So in order to do that, I mentioned a little bit, you can clean surfaces, you can isolate products that may contain gluten from things that do not. You have to make sure that your equipment, your ingredients, your preparation and serving spaces are clean and isolated from what may contain gluten. I use this image here because I think one of the best ways to keep a gluten-free workspace would be if we had little kitchens that were in little bubbles like this, where you could sterilize and clean everything, close it off, and that would be one of the most certain ways to prevent gluten from being in something. One thing that is often overlooked sometimes in designing a gluten-free space within a broader facility is that even air conditioning vents can be a problem. If a gluten-free workstation is downwind of a place where somebody's handling flour, that gluten-free workspace will likely end up contaminated. And you still have to deal with other people. So you may have a gluten-free space, a gluten-free facility, a gluten-free home, but the moment somebody else walks in and is not aware of how to maintain that environment, you risk them contaminating your space. So briefly talk about what you can do for restaurants. Some of these presentations I've given to restaurant groups and industry associations, so I have a little bit of information about that. But along the lines of the air conditioning vents blowing gluten into your gluten-free space, you really need to design your space with gluten and allergens in mind. And that includes testing your ingredients that are going into your foods, finished products that you're serving to customers or packaging, and the surfaces that you're using as you make things. And getting into the people bringing things into your space, you can't test your staff. You can't test the people. And so if somebody has a lunch break and they've eaten a sandwich and they re-enter the workspace with crumbs on their arm, they have now contaminated your gluten-free space. And so in a facility, you want to maintain a testing plan that includes a testing frequency and documentation of how you're testing and what your test results are. And this also can be used as a training tool. If somebody is testing for gluten, you can monitor the success of your training by testing a product that somebody has made and making sure that they have maintained that gluten-free status of the product throughout the process from start to finish. And if you have done this, this will instill awareness in your staff and confidence in what they're doing. And this also allows you to communicate better with customers. So if a restaurant has trained their staff in gluten handling or gluten-free handling, and they have also tested and overseen this process, then when a customer comes in and says, do you have a gluten-free option? How do you maintain that gluten-free workspace? The people in the restaurant can answer that question with knowledge and pass that confidence along to a customer. There's also certifications that facilities can get, but I'm not going to get into details of that. I'm just mentioning it just so that everybody's aware that these are things that are in place. So keeping things gluten-free seems like a constant game of keep away. This is definitely much easier for a consumer than it is for a manufacturer or a restaurant because you have a lot more control over the space that you're working in. Even so, it is very difficult when you're trying something new. So if you have a new product or somebody says, oh, this is wonderful, I think it's gluten-free, you should try it, you don't always know. And this can be very, very anxiety inducing. And particularly when you're talking about anything that has digestive and gut issues, additional anxiety is not something anybody's looking forward to. So you need to know people are respecting your diet, whether that is the service person in the restaurant or the friend coming over for dinner. So in order to maintain all of these things, this is why we test. So I mentioned that gluten-free means that it's less than 20 parts per million, and gluten certified often means less than 10 parts per million, and also requires a rigorous testing plan and audits in place with the manufacturer. This FDA regulation only applies to the packaged foods. If you're in a restaurant being served a product, if you are in a bakery where the products are not being packaged to give to you, this FDA rule does not apply. So generally speaking, if there's no label, there's not going to be any FDA oversight for that claim. The FDA discourages using the phrase gluten-free in those situations. A lot of times you'll see somebody say gluten safe or made in a gluten-free facility, or we don't have any gluten in our bakery, in our kitchen. And those are all the sort of ways that you would know that somebody is making an attempt to keep gluten out of the foods they're giving you. A lot of restaurants don't have gluten-free kitchens in their entirety, but they do attempt to maintain a gluten-free space. And in order to know if that space is being maintained as a gluten-free space, you really need to test. And ultimately, I mentioned the anxiety before, testing is for peace of mind. There's some drawbacks to some of the testing I'm going to talk about later, but ultimately, if you're testing for peace of mind. Whether it's you've already gotten sick from something and you need to know where it came from, or you're on vacation and you want to eat that meal without your stomach being upset before you start. So I mentioned there are limitations. I want to be upfront about that. There is no perfect test. There is no perfect solution. This is just one tool in order to help maintain a gluten-free space and a gluten-free diet. There are a lot of steps involved, and testing is just one of the opportunities to reinforce what you're already doing. So one of the major limitations of testing is that the results are only applicable to what has been tested. What this means is that you may go to a restaurant and have a plate of food. You may have two sides. You may have an entree. You may have an appetizer. When you test, you're only testing one thing at a time. You can try to combine some things and take half of one side and half of another side and say, well, this test goes to 10 parts per million. So if I'm testing half of each, then I'm really testing each one to 20 or whatever you want to do. But really, you're only getting results for what you have tested. A recommendation I often give is if you order a dish and you have a baked potato and you have chicken parmesan, your baked potato is probably free from gluten. That is a low risk food. Your chicken parm, on the other hand, with the breading, you may be more concerned with. So if you're only going to test one thing out of your meal, my personal preference would be to test the food that is most likely to be contaminated with gluten. And again, that gets back to the peace of mind. If there's something that you're going to eat that you're most concerned about, that would be the thing that you are going to benefit the most from testing. And I mentioned you can't test everything. It's cost prohibitive. There are some people that can try to test everything, but the rest of us, you're not testing everything. You're testing the high risk things. You're testing the new products that you've never tried before. And you can't test everything even if you had an infinite number of tests. There are some products that simply cannot be tested. We try to work with customers to find ways to test as many things as we can. But if you have a powdered gelatin, for example, as soon as you add it to a solution in order to try to test it, it's going to form a gel. You can't test it when that happens. This more so applies to manufacturers, but some bakers, people at home may have extremely strong food dyes, like concentrated raspberry juice or something like that. That is probably not going to be able to, you probably won't be able to test that. It's a matter of how the tests are designed and constructed. That dye will just cover the entire test, and you won't be able to see any of the lines to see if the test is positive or negative or valid or invalid. And there's also a waiting time. None of these tests are instantaneous. You are going to have to wait anywhere from 5 to 15 minutes before you have a result. So this testing is done by a lot of different people and in a lot of different places. We're going to focus on the last part of this for the rest of the presentation. But to start off, there are testing laboratories. They can seek various levels of accreditation. That accreditation requires extensive testing, third-party audits, which we're going through right now. That's every 2 years for the type of accreditation that we have, as well as internal audits regularly. And those testing laboratories are typically using an ELISA-based test, which is quantitative. It tells you how much gluten is in something. And those tests can go as low as 2.5 parts per million. When manufacturers are doing the testing, some of them are using testing laboratories. They're sending things out to a local laboratory that they trust, or sending it out to an accredited laboratory so that they can present those results to a third party. Some manufacturers have their own testing laboratory if it's a very, very large company. And a lot of them simply use the lateral flow test for their screening. And this is because they can test things quickly in-house, products coming off their product line. They can swab their manufacturing line. They can test the product when it's finished. They can test their ingredients when they arrive before they add it in to whatever it is they're manufacturing. And so manufacturers may use quantitative testing. That's usually still sending it out to a laboratory, but a lot of them are going to use a qualitative lateral flow test so that they can do it themselves. And finally, we have consumers. That's going to be most of the people here. Consumers are using this to test for in restaurants, using it to test at home. And on the consumer end, every consumer test that is available is a lateral flow test. So these tests are all, as I mentioned, they're all lateral flow. Some of them have additional technology. What you see of the test may be slightly different, but the underlying chemistry and science behind it is a lateral flow device. Each of these vary in the type of antibody they use. This is often a big sticking point for which test you're going to use, because there is no perfect antibody. None of them will detect everything perfectly the same way every time. There are differences, and you really should know what you're looking for when you're deciding which test to use. And of course, I mentioned this a little bit before, testing everything is cost prohibitive. But you do need to be aware of what your costs are going to be, whether you're looking at an upfront cost of a certain amount or an ongoing cost. Those are all different things to think about. So all of the tests have gone through rigorous testing. They've all gone through some sort of validation. Some of them have gone through various certifications. For example, the test we have is one of those. I'll mention about the certifications and the other tests involved in that later. In order to have a product be certified gluten-free, that typically must be tested with a certified test method in order for many of those groups to certify a product as gluten-free. There are several of them available, both to manufacturers and to consumers. I'll talk a little bit more about those in just a moment. And these lateral flow tests are qualitative. That means they are telling you detected or not detected. They're not quantitative. They're not telling you an amount. They're not saying, oh, this product has 20 parts per million or 2 parts per million or 500 parts per million. They're simply saying, do we see it? So I mentioned they're all lateral flow tests. So I'm going to get a little bit technical here for a minute or two. If you don't want to hear anything technical, just skip ahead or zone out. But lateral flow tests are designed based on what you see here on the left. So there is an absorbent pad that uses capillary action to pull your product or your food across this membrane. On the membrane, there's conjugated antibodies, often conjugated to gold particles. There's actual gold atoms on these antibodies that are pulled across this membrane. They interact with a test line that contains the antibodies to the product. So in this case, it would be gluten antibodies. And so these gluten antibodies with gold on them get stuck to gluten. And then the gluten also sticks to these gluten antibodies on the test line. When it sticks there, that means gluten's present. You get a positive line. After that positive line is a control line that simply lets you know, did the test work? Did these particles flow across this strip? And so that test line has a more generic antibody, which is just to test, did your starting antibodies that were applied to the strip in manufacturing flow across, yes or no? On the right, I have a picture from our instructions for the easy gluten test. So this is just what the test looks like. This is a basic lateral flow strip. It's the same technology used in a pregnancy test. And you have different lines. So I mentioned there's a test line and a control line on every lateral flow test. Sometimes you will also see a third line. That third line is referred to as a line. So still going in with this fairly technical description of the lateral flow test and process, sometimes you can overwhelm a lateral flow test with the target. And when that happens, your test line can disappear. When your test line disappears, it appears that you have a negative result. In order to check if a product is really negative or is a high positive, you can add a hook line. When the hook line disappears, that lets you know that there is a large amount of the target present. So what you see here on the right is that as the concentration of gluten increases, the test line appears when gluten is present, but then at very high levels, the hook line begins to vanish. When that hook line begins to vanish, that lets you know there are high levels of gluten present. It's not always necessary to have a hook line, but in the case of a mislabeled product, where instead of using the gluten-free flour, the regular flour was used, that product would have an extremely high level of gluten. And if you tested it using a lateral flow test, you would risk the test giving you a negative result. And so that hook line is there so that you know, nope, this is really a positive. This is in fact a very high positive. So we're going to go a little bit into some test comparisons as we get to the end of this presentation. I mentioned before, all the antibodies are different. I also wanted to reiterate, there is no perfect test. Every test is different. Every test has its drawbacks. Every test has its places where it excels. There is no perfect test. Considerations are the ease of use. Some tests are easier than others. They're all fairly straightforward. One of the examples we use at some shows, such as this one, if it was a live show, would be sometimes we will have a child, maybe 5th grade or so, come over and run one of these tests. It's mostly a matter of if you can read the instructions and follow them without rushing through it, then you're going to be able to run this assay. There's also the consideration of cost. There's also the consideration of what can be tested. I mentioned before, not everything can be tested. The antibodies, we discussed a little bit before. There's the limit of detection. How low do you need to go? Are you concerned with, is this product gluten-free by the FDA standard? Are you concerned with, is this product below 10 parts per million as what would be required for most certifications? And you also need to be able to interpret the results. And if you are particularly a manufacturer, you may also want to be recording the results in some way. So these are all the lateral flow tests that I was able to pull up based on either what is available to consumers or what has gone through the third-party PTM certifications that I'd mentioned before. Those certifications are developed by AOAC, which is the organization that helps determine what a lot of the food standards are when the FDA goes to finalize things. So the lateral flow tests here are the Easy Gluten test manufactured by ELISA Technologies. There's the NEMA sensor, which is manufactured by NEMA Labs. Gluten Tox, both the home version and the pro version by Hygiena. There's a 3M kit. There's a kit from Romer Labs called the AgroStrip, and there is a test from our biofarm referred to as the Rite-A-Quick Gluten. So the first 3 tests here are the ones that have been made available to consumers. The Easy Gluten NEMA sensor and Gluten Tox Home. So I'm going to talk a bit more about those later because those are the only ones that most people are able to purchase. And the ones with stars are the ones that have undergone that additional third-party certification, which would be the Easy Gluten, the Gluten Tox Pro, the 3M, the Romer, and the Our Biofarm tests. So in deciding which test you're going to use, you need to know about the applicability. Has this test been approved or validated in your application? Validation reports are typically available by the manufacturer upon request or perhaps from the website. Sometimes you can go look for yourself and see, oh, well, I really want to test Italian sausage. And I see here they've tested Italian sausage in their validations, and they've done a spike in Italian sausage. And so they know they've already shown that they can test it. It doesn't interfere. I'm confident that I can use this to test my Italian sausage. Whatever it is, if it's not in the validation report, sometimes you can ask, and there's been some other testing, and you can get some information on that. Also, surface testing. You may be interested to know, well, so I'm going to make some cookies for my friend, and I know they're gluten-free, but I don't really know if my cutting board is clean. Has this test been validated for surfaces? Matrices is the food type. We talked about that. The Italian sausage, biscuits, dough, beverages, whatever it is that's being tested. The validation, which is often done by a third-party testing. There's also in-house verifications, and the support. So if you do anything often enough, one day eventually, no matter how good it is, you're going to have a problem. So you need to know that you can get feedback when you have a problem, whether there's somebody that you can call, somebody you can email, online support, whatever it is. You need to just make sure you know where that support is before you start. So these home tests, I mentioned cost prohibitive. If you want to test everything, they range from about $6 up to $17.50 per test, depending on which one you're buying, depending on how many of them you're purchasing. Some of them require an upfront purchase before you can start running the tests. All of them can be stored either refrigerated or at room temperature. I believe all of them are shipped at room temperature. And so they're all very stable. Ours are shipped from Florida. So in the summer, we're shipping things out, and we have gone through the studies to make sure that they are stable at temperatures well above 90 degrees for extended periods of time. And for all of these tests, everything you need to run is included in the assays. There are no additional tools required. So getting into the details about what these different tests are. So I mentioned the home tests are the Easy Gluten, the GlutenTox Home. I didn't specify that here, but that is the GlutenTox Home, and the NEMA sensor. So Easy Gluten was developed by ELISA Technologies in Gainesville, Florida. That is where it is still manufactured and shipped from in the US. GlutenTox is a kit that was developed by Biomedal, which is a Spanish company, which has been purchased by Hygiena, which is a large multinational company in this field and other fields, and they do have distribution here in the US. And the NEMA sensor was developed by NEMA Labs. I know they have been recently acquired sometime earlier this year, but they did not disclose who they were acquired by. The different formats for these kits, I mentioned they are all lateral flow tests, but they do look different. So the Easy Gluten test, you saw the picture of that one earlier. It is just the strip, and it has red control test and hook lines. The GlutenTox is a little bit fancier. It comes inside of a cassette, so you're not seeing the entire bare strip, and the test lines are red with a blue control line in order to help visualize that result. And then the NEMA sensor still uses a lateral flow strip. It's a smaller strip, so it doesn't take quite as long for the liquid to pass along it. But that strip is packaged inside of a detector that reads those control and test lines. I mentioned before that antibodies are critical in any antibody-based test, whether it's an ELISA-based test or lateral flow test. So the antibodies used in these assays, the Easy Gluten uses the Scarrett antibody. This is one of the oldest antibodies used to test gluten. So there's also a lot of studies on it. If you want more information on that, it detects both gliadin and glutenin, so both of the major protein fractions within gluten. It is slightly less reactive to barley gluten. I know in the ELISA format that we have, it detects barley at about 25 to 30% the level of wheat barley, but the Easy Gluten test is calibrated such that barley gluten is still detected at least at 10 parts per million. The GlutenTox kit used the G12 antibody. That is one of the newer gluten antibodies that was designed specifically to a 33-mer of alpha gliadin. That 33-mer is the most immunoreactive epitope for people with celiac disease. So this antibody was designed specifically to that epitope within alpha gliadin, although it does cross-react with some oat varieties, which some people want to test for gluten as well as oats. And the NEMA sensor test uses two newer proprietary antibodies that are both designed to the 33-mer of alpha gliadin, similar to the way that the G12 is designed. The antibodies don't recognize a full 33 amino acids. I believe the G12 recognizes the last 6 or so specifically that are repeated within that 33-mer. And so even though all three of those antibodies are designed to the same fragment, they are all slightly different from each other in the way they detect gluten. There are detection limits that vary by test kit. So the Easy Gluten is sensitive at least as low as 10 parts per million, and that has been validated with the third-party testing. It can be sensitive lower than that for some products, but 10 ppm is the cutoff for the 100% reliability. GlutenTox varies depending on how you're setting up that assay. It either has a 5 or a 20 ppm detection limit, and NEMA is designed to detect gluten at 20 parts per million. And I think we did have a question about testing of avenin, which would be specific to oats. I'm not personally aware of any test that specifically is for only oats, but I know there are some. I mentioned the G12 that has some overlap that will also detect at least some oat varieties. So some of the other differences, there's a time consideration in all of these. I mentioned none of these are instantaneous. There are other test methods, not for gluten, that can yield very quick results, but there is still a process involved in the detection for gluten. So easy gluten and gluten tox are both very similar in that regard. They both take about 10 to 15 minutes from start to finish. When I say start to finish, I'm referring to you have a food sitting in front of you on a table to the time that you know the result. So the whole process, 10 to 15 minutes for each of those, and about 5 to 10 for the NEMA sensor. The cost and availability, because cost is always a consideration. The easy gluten, depending on the number of kits you're buying at a time, ranges from about $10 to $13 per test. That cost does not include shipping, so shipping is in addition to that. The gluten tox, I believe they include shipping in most of their numbers, and theirs runs about $14 to $17.50 per test. And the NEMA sensor runs around $6 per test, but does require an upfront purchase of the device that they have, the little triangular device that some of you may have seen. So that wraps up most of the meat of what I wanted to talk about. As I mentioned, if you're doing this often enough, you are going to run into problems. It doesn't matter how well designed something is. Eventually, you're going to find something. You're going to have a question. So if you run into a problem matrix or a problem food, or you're testing a new ingredient, or you are a restaurant and you have consumers that are making new requests, or you have a new staff at your restaurant or your bakery that you need to train, those are all times that you may want to reach out, contact either an industry group, a local laboratory, an accredited laboratory that's either local or elsewhere, or one of the training organizations that help to train people. I know one of them would be FARE, F-A-R-E, not an endorsement, not associated with them, but I've seen them at a lot of shows. Also, they do training and can help people. They have some resources on their website also for I think some of their trainings may actually be freely available. And so those are all places that can provide some sort of guidance and answers when you eventually want to know more. So that is all I have for the presentation. I'd be happy to try to get through questions right now. There are a couple questions that came in during the presentation. I've got one here. You click back to that one. Troy had asked if any of the tests are for food sensitivities and gluten or just for gluten. So those tests are all for gluten. Some of them are different fragments of gluten, but they don't test for the sensitivities. If you're asking about testing people, we only test food and products. Then there are some tests, home tests and otherwise, that are supposed to identify whether somebody has a sensitivity. If it's for celiac disease, I know that is the most specific would be done with a biopsy, intestinal biopsy, as well as a blood screen to see if you have those transglutaminase antibodies in your system. So there is a slight lag between the presentation and the questions. So I'm going to give another couple minutes here to see if any other questions show up before wrapping this up. But for all of you that have stuck through this from the the quiet beginning, I'm sorry about that, all the way through to the end, thank you very much for your time. I hope that you all stay safe. We're down here in Florida, so we're doing our best. I didn't even mention that Nick here helping me out is on the other side of the office with a mask on. Thank you very much to him for that. So I'm going to go ahead and turn off the presentation so you can see my pandemic hair. And it can be a little more personal for any questions I'm trying to answer here. So okay, Nick is handling the questions and putting them up on the screen right in front of me there. So we've got another question of, do we provide any allergen test kits beyond gluten? The only home test kit that we provide is for gluten. We do in-house testing for the other major allergens, such as soy and milk and egg and crustacean. and peanuts and tree nuts, but we don't have any home tests for any of those at this time. But thank you for asking. That is something we are very interested in working on. We have a question of, do any of these tests work to test medications? So medications are a bit different as far as testing goes. We do tests in-house for medications. I don't believe any of the test kits have been certified by a third party to test medications, but they can be used to test medications. So the main thing that we worry about when we're testing medications here that people have sent in to us for ELISA-based testing is to make sure you're testing the entire product. So sometimes when you have a medication, you may be worried about what's in the medication, but you also need to worry about how it's packaged. So if something is a powder in a pill, we make sure to open up that pill capsule and test both the contents as well as that outer capsule. So if you're going to be testing a medication, just make sure that it's ground up, that it's opened up, whatever it is, to make sure that you're testing both the inside and the outside of that product. And really that goes for anything you're testing. If it is something that has a unique exterior, but has been manufactured, make sure that you're testing both the outside and the inside, because gluten could have been introduced in the manufacturing process to the inside of it. It also could have been introduced during the packaging process or something, and that may leave residue on the outside. Oh, yeah. You just move the windows side to side. You see both of them up there. So as far, there's a question about any developments occurring to improve the testing and cost basis. I can't speak much for other manufacturers along those lines. I can tell you about what we've done. So what we've done, we did have one price increase. We've had this product for well over 10 or 12 years now. We had one 5% price increase during that entire span because we recognize these products are very difficult, especially for home users. This started off being something available for industry, and we wanted to do everything we could to keep the cost down. So as our costs have gone up, we've eaten some of that cost in order to avoid passing along. And we've also made many changes to our design process and our in-house process to try to reduce our costs so that we can avoid passing any of those costs on. So the biggest change as far as the cost basis is the prices aren't going up with inflation. There's not a whole lot more we can do. The problems that we have are those gold particles that go onto the strips are very expensive. So there's a high cost involved in that. And the largest cost that we have is probably labor. So everything that we do is manufactured here in our facility in Florida. Every strip is handled by a person. Every single strip is visually inspected before it is placed into the package. I think everybody here at our facility, I'm looking around even though I'm in a closed room and can't see anybody other than Nick, but everybody here at our facility has helped in handling those strips and packing them. So it is a very labor intensive process. And there's not a whole lot more that we can do other than not adjusting for inflation. Some other things, we've got a question. How does this work if you're going to eat a bowl of spaghetti? Are we testing just a tiny part of the dish? And if so, how do we know if the entire bowl of the spaghetti is gluten-free? So I mentioned that a little bit earlier, but it's worth going over again for anybody that missed it, and just to reiterate, maybe even go over in more detail. So if you have a plate of food, a bowl of spaghetti, for example, I would be most concerned personally about whether there is gluten present in the noodles, and if the noodles are gluten-free, and the sauce, or meatballs if you had meatballs. So you could either say, this has all been cooked together, I'm just going to test the sauce because everything's in the sauce at this point, and you may test that. Or you may be most concerned with, did they use their gluten-free noodles? And if the primary concern is, did they use their gluten-free noodles, then you would just take a portion of the noodle and test it. The big thing to me in doing this testing is making sure that you've done the testing necessary to give yourself some peace of mind in what you are about to eat. You've already ordered the food. You've already got it there. what can you do to make sure that your stomach is settled before consuming that food? And so you may want to take a little bit of each part and test it, or you may just want to take the highest risk part and test that. But ultimately, that's going to be something you have to decide for your own level of comfort. And I did mention earlier, that is probably the largest drawback and limitation to doing any of this sort of testing, is that you're only going to get a result for what you've tested. So make sure that what you're testing is what you're most concerned about and what you're most interested in having a result for. All right, do we know anyone in South Carolina that does in-house testing? I don't personally. One thing that we do here, I mean, I come from a medical science background. We treat our customer information kind of the same way I treat HIPAA stuff when I worked in a hospital doing research there. We won't disclose any of our customers. So unfortunately, that means that if someone else here has an answer to Troy's question about anybody doing South Carolina, in-house testing in South Carolina, go ahead and answer him there. But that's not something that we would be able to provide an answer to, unfortunately, just because we do take customer privacy very seriously here for everything we do, both our product sales and our testing. I've got a question. Doesn't start with does, but NEMA uses a pea-sized test sample. What about the gluten sample size, easy gluten sample size? So for our test, we provide a small spoon that comes in the test kit, and you simply fill that spoon. You don't have to worry about measuring how big you think a pea may be or what a gram or a half gram would be. You simply take your food and you fill the spoon, and once that spoon's filled, you dump it into the extraction solution. And that's it. So we try to keep it as straightforward as possible. Do the tests and test strips have a shelf life or expiration? Absolutely, they all do. The ones that we manufacture have a shelf life of 12 months from the date of manufacture. We are typically shipping our products out within 1, sometimes up to 3 months, depending on how we've scheduled our production from the date of manufacture. So when you receive a product from us, the new ones that we're going to be making have an expiration of, I believe, this is September, so they'll have an expiration of October, and those will probably begin shipping next month. So we will be shipping products next month that have a 1-year shelf life from the time a customer receives them. And by the end of the cycle of that batch, they'll be shipped out with about a 9 to 10 month shelf life remaining. And you can always ask, we're open to those questions. If you're going to make a purchase, you can contact us and ask what the current expiration is if you're trying to decide on purchasing a larger bulk quantity and whether it's going to last. Got a question about testing makeup and items that are sticky. So that's a tough one, because some products you may not know until you try to run the test. The recommendation there would be, if it's a very unusual or unique matrix, you may want to contact us or whoever the manufacturer is for the test you're using beforehand and ask if they've tested that particular product, and ask for other advice. So sometimes I said we use a measured spoonful for testing our products. However, the required minimum amount to reach that 10 ppm threshold for our product is 0.5 grams. So that spoon will sometimes measure a little more than 0.5 grams. You'll always get an accurate result using the measured spoonful. But for some difficult products, you can make sure that you're only using 0.5 grams. For home users, that's not really going to be something that you can often do unless you have a very precise kitchen scale. But 0.5 grams is the minimum amount that you could use if you have a difficult product. The other option is you just contact us, ask if we've tested it, ask if we have any information about it. And we usually try to work through that before you're just burning through test strips on your own, troubleshooting something that we would be happy to help you with. Do we have a special show package price for your product? Actually, yes, we do. Wonderful question. So somewhere on the page, I could check it right now, but somewhere on our product page, there is a 10% discount. So that is a coupon that you would enter when you go to our website to purchase the product, and get 10% off of that during the show. don't remember exactly the expiration date for that, but I know it is going on at least through the end of the show, and possibly a little bit longer. It's on the show page.
Oh, okay. Yeah.
Okay. There's a question. Does ELISA have support, and how about other kit manufacturers? If you are asking about support for customers, yes, we have that. During non-pandemic times, we are open here 5 days a week, 8 to 5 Eastern time. Everybody who answers the phone here, I said everybody in our building has packaged these products and handled them. So everybody that answers the phone has at least some knowledge of the test, the troubleshooting, things like that, whether it's, everybody here has knowledge of that. So if the person who answers your phone can't answer the question, someone else here is. We can grab one of the people that handle manufacturing, one of the scientists here, and we'll always answer whatever questions you have. The way things are right now, we don't have as many people in the office at any given time, and so unfortunately, you might have to send us an email to get that answer. I say unfortunately because we kind of pride ourselves on always answering the phone and giving the answer right then, but it's just not something that we can do every day the way things are currently. How do we order these test kits? I'm hoping that by these you're referring to the Easy Gluten test kits. But you can order the test kits generally from the manufacturer's websites. For ours, you can go to easygluten.com. I can maybe put that up on the screen. Oh, actually, Nick can go ahead and make sure to put the website in there in the chat box as well. Yeah, go ahead and just put the URL right in there. Make sure everybody has it. So you can order our test kits directly from our website. The Nourish Festival site, from our booth, there's a link there. You can click through our booth. We have some information. There's an FAQ about testing, which covers some of the things that have been discussed here in this presentation. Also more than happy to answer any other questions that anybody has. What else? So there's a few different options for the pack sizes when you order those, and so you'll see the difference in prices based on those. What is the accuracy of the Easy Gluten test strips? So I'm a scientist. I'm going to answer that with a very scientific answer. If that's not what you're looking for, then please correct me and ask again. So accuracy is how close something is to the target value, as opposed to precision, which is just consistency. The accuracy of these test strips, I will refer to the third-party validations. So the Easy Gluten is the test that established the PTM certification for gluten lateral flow tests. And in doing so, there's an extensive third-party testing that was done for that. We can share our data. We try to keep everything as open as possible here. The third-party testing showed 100% accuracy at 10 parts per million. When you get down lower concentrations, I think around 5 parts per million, we had about 70%, 80% accuracy, something like that. And so we took 10 ppm as our cutoff of reliable detection, because that is what was showed through all of the third-party testing at 100% accuracy was 10 ppm. Is your test kit certified by the FDA? So there is no certification by the FDA of test kits like this. So there are certifications that utilize this test kit, but there is no FDA certification of this test kit. The only certifications that we would get as a test kit would be a PTM certification that comes from the AOAC, which is formerly the Association of Official Analytical Chemists, but it is the scientific and trade organization that helps to determine these standards and how a test must function and things like that. So that would be the certification typically that would be used. The FDA leans heavily on the expertise of the AOAC in setting limits of what can be tested, what can be detected, and how it would be tested. And the AOAC meeting actually wrapped up, I think, yesterday, their annual meeting. So if you have any questions about that, I might be able to answer something there too. Can you help for training with businesses? Yes, we can. So I mentioned before that testing can be used as a training tool. So if anybody wants help how to set something like that up, why you would do it, what you should be concerned with as far as potential sources of gluten in a kitchen, in your staff, any of that training and things like that. Reach out. We'd be more than happy to walk you through that process and answer everything we could. Good answer for the actually. You're welcome.
I think that was it.
That was everything. Okay, I'll give it another minute or so. We are actually at the end point for this presentation on time. So go ahead and you've got the website in there. Make sure to put the email address in also for anybody who's watching.
Oh, okay.
So the text is not going to show up in the live feed, which is one reason I was making sure to read all these answers back to you. But if you have any questions for us, you can go to easygluten.com, and that is our website, so we can answer things there. You can also email us at info@elisa, ELISA-tech.com, and we'd be more than happy to walk you through things, help you figure stuff out. Going to share the presentation page that has that site right now, so that it's also part of the presentation for anybody watching this later that wants that information. So this is the last you're seeing of me. Thank you very much for your time. If you have any further questions, you can, I mentioned before, you can email Justin at ElisaTech. That's me. If you want to email me directly, emailing us more broadly, which comes to me and a few other people here, would be info@elisatech.com, as you see on the screen. And our websites are elisatech.com for the main page and easygluten.com specifically for the Easy Gluten product. So again, thank you very much. Please enjoy the rest of the show. This is a very unique format and everything for all of us. So I appreciate your patience, and please stay safe. So just
Hit it out.
Yep, just hit the X and the presentation's over.
There you go.